Good afternoon, our viewers. Good afternoon, our ladies and gentlemen in Sudan. Good afternoon, and ladies and gentlemen in the United States. Welcome to this lecture of the Sudanese American Physicians Association series of COVID-19 related lectures directed toward healthcare providers in an attempt to help everyone fighting this pandemic that is affecting our lives, our health, and our economy. We're pleased to go ahead today with our scheduled lecture directed toward the mental health effects of a COVID-19 pandemic. As we know, this pandemic has affected the health, the economy, the public, the patients from all aspects, but also it has all those mental and psychological effects that extends to the patients, the families, the healthcare providers, and even the public. From that perspective, I'm happy to have my guest today, who is going to be joining me to talk about this topic. I'm welcoming Dr. Yassir Osama. He's an assistant professor of psychiatry in Penn State College of Medicine in Hershey, Pennsylvania. I would like also to welcome Dr. Louai Bilal. He's also the director of Inpatient Psychiatry in Kaiser, Permanente, California. I'd like also to welcome Dr. Hanan Khairalla, who is a psychiatrist in Massachusetts. I would like also to welcome Dr. Timothy Zeiger, a licensed psychologist located down here in Hershey, Pennsylvania. Welcome, everybody.
Welcome, and thanks for having us.
Thank you so much for having us.
All right. I have a little technical issues with Dr. Hanan, but in the meantime, we're going to start with Dr. Yassir. How are you doing, Dr. Yassir? If you can just start with kind of introducing yourself for a second, let us know where you're working currently.
All right. Thank you very much, Akram, for having me, and thanks for SAPA for extending this opportunity for us in order to talk about the topic of mental illness and mental health, especially in the era of COVID-19. My name is Dr. Yassir Mahgoub. I currently work at Hershey, Pennsylvania as assistant professor in the Department of Psychiatry.
Hi, Dr. Yassir. Thank you very much for joining us today. So we going to start with your part. As we know, the COVID-19 has a lot of stress and distress that is inflicted on the patients, the families, the public, and the healthcare providers. So starting from that perspective, we'd like just to hear a little bit from you about the stress that the COVID-19 is putting on the community and the healthcare providers. So you're going to start with the presentation here. Go ahead, Dr. Yassir.
All right. So first of all, today we're going to talk exactly about our objectives in this discussion. All right. First of all, we have disclosure that we don't have any relevant financial disclosure here, all of us. The second thing here, our talk today is mainly educational. It's not intended to give any individual medical advice and should not be used as a substitute for. So if you have your own physician or you need a specific mental health advice or concern, please reach out to your provider or seek a provider. However, we're trying to give education and help for the population here. So speaking about, if you can go to the previous slide. Yeah. So next one, please. Yes, thank you. So we'll talk about our objectives today. We're going to conceptualize the COVID-19 pandemic as a psychologically stressful event and define and describe exactly the human response to stress. We're going to move to describe different presentation that could be seen in reaction to stress for general population and for the healthcare providers. We're going to be talking again about the means of coping for individuals, children, and families. We're going to provide some guidance and some resources, including some professional resources. And we'll give space for questions and answers at the end of our discussion. All right. So my part today, I'm going to be talking about the concept of stress. I'm going to be also be talking about resilience. I'm going to be talking about how the COVID-19 is affecting the population right now. So when we come to the concept of stress, different people mean different things by talking about stress. It's a word or a term used by people from different nations, and they use the same word stress in different, verbatims. But it means something different. And when I went to discuss, to look at the origin of this word, actually, I found that it was named and coined by an endocrinologist. His name was Hans Shaley, and he was studying animals, laboratory animals. He was subjecting them to various stressors. And actually, in stressors, when they study animals, they subjecting them to noise, bright light, different forms of temperatures. And he found that with sustained stress over a prolonged period of time, that these animals had changes, physiological changes, enlargement of the adrenal glands, lymphoid tissue, changes, as well as they had some stomach ulcers. And he came with the concept that some stressors tend to affect the community and tend to affect human beings to cause disease. This became actually very famous around in 1936. He came with the definition, which I like very much, which is basically the non-specific response of the body to at any demand for change. And I like this definition because it describes stress in a general point. So not all of the stressors are negative stressors. Sometimes stressors can be positive, or sometimes can have a positive influence on human being. However, the term stress has been used actually to describe distress. And when we talk about stress, generally in psychiatry, what we mean is basically physical, emotional, and mental strain or tension. So with the changes of COVID-19, first of all, life was full of stress. Everybody was dealing with different stressors at different levels. People this was before the COVID-19, financial stressors, relationship difficulties, work difficulties. It was affecting people in different ways. However, I think toward the end of the last year, and it started with China, and I think every country has been affected differently at different time frame. It caused this similar effect nationwide and in every country. So people suddenly stopped working. They have not been able to go to their job. Here in the United States, more than 30 million Americans filled unemployment in the last 6 weeks. And I actually read yesterday that more about 3.2 million filed unemployment only just last week. So with people losing, their jobs and security of, being able to afford, they're unable to pay for their rent, they're unable to afford, getting food, they're unable to take care of themselves, they're unable to take care of their families. And those risk factors, when we mention economical challenges or stressors, those are risk factors that were studied actually for being risk factors for depression, being risk factors for suicide at an extreme level. Again, this has affected millions of people at the same time. It was not just only this economical part, but the economical part was a significant aspect of it too. Again, people were asked to stay at home. The concept of social distance has become very common. People have been misunderstanding this by trying to stay at home, not to communicate and actually relate to people. And isolation and the sense of loneliness tend to be causing depression for many people. It's the risk factor for developing depression and maintaining depression. It's a risk factor for actually suicide, also at an extreme level. People should actually still continue to socialize with each other. They should just keep a physical distance from each other, not to stop socializing. However, people stopped, and it became another level of stress. Again, with being bound to staying at home most of the time, there was a lot of decrease in means of getting support, including religious support and the community support. Several studies on suicide found that people who go to, religious services have a reduced risk of suicide at least by 5 times. And it provides enough support for people. People like to go to the mosque, church, synagogue in order to get that support. And suddenly people were asked, look, they have to stay at home because of their health, with some explanation, but even the explanation were limited because of the amount of information provided. Again, there was a disruption of daily routine. People are used to have a routine by going to work, going to the gym, going for shopping, going to restaurants, going to socialize, meet with each other. We are Sudanese. We like to socialize. We like to go with each other. This is the month of Ramadan. We had the habit of going to have iftar with each other. This is not happening anymore. You can barely just have this with your own family. And this resulted in a significant disruption of our daily routine. Again, the major part is basically the fear of the illness and the fear of death. Initially, the initial message that was passed from China, this is an illness that tend to affect elderly, and people the elderly people, they were feeling afraid and scared and stayed at home. They felt like they're being singled out. They're left to stay at home to die there. However, with more information coming, we found that people of different ages, people with no comorbidities are dying. And every time, when you think about this, you're staying at home, you don't have a job, you cannot be able to afford for your family, you have limited support, you're thinking about the disease and the illness, you're opening the news and they're talking about the illness 24/7, exaggerating things, absent tests, people died, people texting you in groups, and you start the anxiety and the fear start building up. So again, when we talk about psychological stress, is all the stress bad or all the stress good? Again, it's a subjective phenomena. What might constitute stress for me might be different for what constitutes stress for somebody else. It depends on somebody's ability to handle stress, process things, his resilience level, and it depends on the magnitude and the amount of stressors. So there was actually a law and a curve done actually in order to check the performance and the stress and anxiety. For people to learn and for people to achieve optimum performance, some level of stress is positive, is needed. It promotes you to learn. It promotes you to protect yourself. And when it gets overwhelming and it moves actually, at some point, people's ability becomes exhausted. And this is when stress or an anxiety becomes actually negative. But some anxiety is actually very protective. So nowadays, people became vigilant, scared of developing the disease, watching the news to some extent, trying to wash their hands, trying to protect themselves, try to do the best, save money, save things. This is okay. Everybody's almost going through this. That's not a disease. That's not a problem. Actually, this is very protective. The problem occurs when we exceed our ability by exhausting ourselves. There are a lot of things that we have been doing lately by focusing on the negatives, not taking enough rest. This is exactly when the optimum performance goes down in a slippery slope. And again, an anxiety becomes overwhelming. We lose our ability to think clearly, and then we can reach a stage of complete meltdown. So what's the goal here? Again, we've been hearing about lower the curve, trying to flatten the curve, trying to flatten the curve. Our curve is a little bit different here. So some level of stress, some level of an anxiety is helpful, is protective, is needed. Nobody wants to take the state of vigilance from you. Actually, it becomes concerning when you're not vigilant, when you're not concerned about your health. We're dealing with this in Sudan right now due to some ignorance, due to some lack of knowledge about exactly how serious this issue. People are basically living in denial. They're not concerned enough. And that's actually concerning. People are not becoming vigilant. They're not protecting themselves. Some level of an anxiety, some level of vigilance, and actually promotes safety and promotes people to protect themselves. And this is needed. The problem is exactly when we exceed our limits. So when we talk about resilience, it's not just a simple denial. Denial is not a protective mechanism. Actually, this is going to get us killed. This is going to get us, to die if we just, don't take any precautions or don't take care of ourselves. Some level of an anxiety, some level of vigilance is important. What we mean by resilience is the positive adaptation after stressful events, or adverse situation through the integration of physical, emotional, spiritual aspects. So it just promotes us to learn. And again, when people are subjected to stress, people respond differently. So again, some people will just erupt in anger. They just lose their temper, and they're angry all the time. They lash on people. They get angry with others because this is exactly what happens to them, and they can't handle this. Other people will sometimes just go with negative emotions, overwhelming negative emotions. They feel numb. They don't react. Those two, they don't they have their resilient level does not protect them. People who become resilient, they still get upset with what is happening, but then they take the next step of how to handle things. Some advice is actually, there was a good paper. I'll try to post this later on Facebook, that was made in 2007, was made by multiple international experts in stress, in anxiety, in PTSD. They were talking exactly about how to handle stress that affects actually the community, or affects actually people internationally. And they came with 5 advices that can be utilized differently at different levels. So first of all, they advise people to promote the sense of safety. When it comes to COVID-19 here, people know this is a dangerous virus that can be lethal. It tends to affect some people more than others. However, how can you feel safe if it's outside and actually might be transmitted to you? Again, we need to become realistic about exactly what is a real threat and a perceived threat, because a perceived threat can become overwhelming. If we watch the news all the time and we just focus on the negatives of it rather than the positive, focus on the people who died, focus on the people who had actually overwhelming consequences because of this, rather than focusing on the number of people who recovered, the number of resources that we have, how to overcome this, it becomes overwhelming. So we need to promote the sense of safety for us. Also promote calming effect. This becomes a little bit challenging if you're not able to sleep well, if you're tense all the time, if we're watching the news all the time. If you're around people who just become negative, we have to kind of try to promote calming. This is really important, and I think my colleague Dr. Zeiger is going to mention that later on, especially for family, how to promote the sense of calming can help children, can help the family in order to move on, to think clearly about how to manage things effectively. Again, to promote the sense of self-efficacy and collective efficacy. Before this happened, we were dealing with life either effectively, or we were handling things well. When things change, it results in change in balance and equilibrium, and we lose our ability to control things, which is the problem for human being. We tend to restart again doing this either with help or with others. How to become helpful, how to become in control, how to think outside the box in order how to help ourselves and help others. When we feel like we master this, we have the control, it gives us a positive energy and feeling about how to handle the difficulties. Okay. And again, to promote the feeling, the connectedness, we need to be this, we're all handling this issue. We need to help each other. We need to stand by each other. And to promote hope. Again, hope, and again, just promoting negativity all the time just is going to drain people. It's going to drain their energy. We need to promote hope in order to be able to move and to overcome this difficult time.
Well, thank you very much, Dr. Yassir. I appreciate all this valuable talk about the stress component of this pandemic. I think it helps us a lot to understand how this pandemic is actually inflecting and starting all those stress reactions in our minds. But that was very valuable. Thank you very much. So I just want to remind all the viewers that we're going to take all your questions through comments on our live streaming on Facebook and YouTube. It's basically in the SAPA Facebook page, Sudanese American Physicians Association SAPA, and also on the YouTube channel of the association. We're going to take all those questions in the comment and help answering them at the end. I'm going to be moving through here to my second speaker, Dr. Louai Bilal. Dr. Louai, thank you very much for joining us today. I'd like you just to start by introducing yourself, and then we're going to go to your part of the presentation.
Thank you very much, Dr. Akram. It's absolutely a pleasure to be here. And thank you, SAPA, for organizing this, and for my good colleagues, Dr. Yassir, Dr. Timothy, Dr. Hanan, and for you, Dr. Akram, and Dr. Mahmoud, who's helping us in the background. My name is Louai Bilal. I'm a psychiatrist, and I work in inpatient psychiatry as a director of a hospital unit in Kaiser, Permanente. And I'm going to be trying to answer your very good question. Can stress lead to mental illness? And I would like to go to the slides to really do 4 things that are all interrelated. So I'm going to review how stress affects the human brain. I'm going to try and explain the relationship between stress and mental illness symptoms, and then really list some of the common presentations of mental illness, so it's clearer for the audience. And lastly, end by letting you know when to seek professional help. So this really piggybacks on Dr. Yassir's excellent expounding on stress and what it is, and really tries and place coping and resilience within 3 zones. If you ask yourself during this tough time when you're hearing about this deadly pandemic and what it means for one's own life and one's own prospects, you can ask, where am I during the COVID-19? And there are 3 zones: the fear zone, the learning zone, and the growing zone. So basically, this is where we all were at the fear zone. Some of the signs of that is panic buying, for example, or getting easily annoyed, or really stocking on food, medicines, toilet paper, stuff you may not need. This is a sign that we're in the fear zone. The second happens naturally for most people, which is the learning zone. People start releasing the control. They stop consuming what doesn't make them feel good, like even the news. They stop consuming the news at the rate they have been, or food that is maybe too salty or too sugary, and then recognize that we're all trying to do our best to face a complicated situation. So this is sort of really knowing that we're all in it. So this is when we start to learn. And then the last zone is the growing zone. This is a sign of someone who's achieved excellent coping and showed excellent resilience, where they're thinking about other people. So it's not all about me. I'm not going to have a job. Maybe I'm going to lose my house. It's taking it day by day and thinking of how can I be helpful to other people. And then finding purpose. Some people actually use the time to do some other things, to learn a skill or a craft. And then feeling grateful is a sign of resilience. I can share with you all, you know this, I know this, that this pandemic hit at a time when we can have this live streaming, when we can easily connect with each other, where our technology enables us to get food out our home. So just if you take a second to think about this tremendously advanced connectivity that we all have is really a source of great gratitude. And then to take it day by day. So now to be able to see if stress can cause mental health symptoms, we want to understand how does it affect the brain. We don't usually think of our brain in our usual day-to-day waking life, but it's there, of course, and it's running a lot of the different functions and the entirety of the body. So all this information about a deadly pandemic and what it could mean in terms of our own mortality or our prospects does affect the brain. The brain is very, very good at assigning meaning, which means you may digest the information in a certain way, and maybe have or wish for a pragmatic approach to just maybe wash your hands, keep your distance away, stay at home, like you're being told by healthcare professionals. But the brain behaves differently. The brain kicks in a survival mechanism, which really says that inside of you there is an organ that thinks you're in danger. So what does it do? It activates the alarm reaction. How does that happen? At deep parts of the brain, close to the organ that controls equilibrium and homeostasis, the hypothalamus, is surrounded by older structure of your brain called the limbic system. This is the emotional brain, and it's the information that you're in danger. So the pituitary gland, which is right behind the hypothalamus, starts releasing ACTH, which affects the adrenal gland, and this starts pumping both adrenaline and cortisol. So it wants to ready you for this sympathetic fight or flight reaction. It's really like being attacked or being in danger. So the body starts preparing you for that. The autonomic nervous system, which controls all your internal organs and functions, also gets very activated, and the parasympathetic areas which subsume relaxation are not. So you're in this state of readiness to do something, and that's why a lot of the time you may not need that. You understood the information, you understood what this pandemic is, but your body is still acting as if you're in extreme danger. Okay, now what is the stress response? This really harkens back again to Dr. Yassir's maybe second or third slide about the general adaptation syndrome described by Hans Scheer in the 1930s. And it just tells you that this happens in a set way. There are 3 stages for this stress that we saw how the brain reacts to, and how it generates all these hormones and readies the human organism. The first stage is called the alarm stage. Here, the body reacts to the stress. The sympathetic nervous system is in overdrive. The hypothalamic pituitary axis is overactivated. So you are ready for any danger. The information remains the same. COVID-19 is out there. You still need to do what you need to do, but your body is still in that hyperactivated state. So we enter the second stage, which is the resistance. Here, your body starts to adapt to stress. So it's a state that is there. There is sustained release of cortisol, and that really is necessary to maintain arousal. So you're always awake and alert. This is really too much for the body if it goes on for so much time and there is no resolution and there is really no relief from it. So we enter the third stage, which is the state of exhaustion. This is where the body's resources have been depleted. This is what commonly is known as burnout, or some people call it nervous breakdown, or they call it mental exhaustion. So this is not mental illness yet. Okay, so when does stress cause mental illness, or how does it cause mental illness? The best explanation for it is this diathesis stress model. So here, it really wants you to think of 2 things. Are you predisposed to develop mental illness? Have you been subjected to some sort of birth injury, to trauma? Have you experienced such events before? Have you had experiences with depression, Do you have any socio-economic disadvantages? So are you vulnerable to mental illness? So that's the diagnosis. The second thing is the stress itself. How much stress? And to really try and simplify it, it's the more vulnerable you are for mental illness and the higher the stress level, the more likely it is that you can get mental illness or mental illness symptoms. The good news about that is that if you look at the graph that's projected, where you have on the y-axis of the left-hand side the amount of stress, and on the x-axis of the bottom axis the predisposition for the disorder, you can follow the arrows. So if the predisposition gets higher and higher, and the amount of stress gets higher and higher, the disorder manifests. But you can notice that when the disorder does not manifest is the majority of the time. Okay. All right, so now let's suppose that you have been subjected to a large amount of stress and that you, because of your disposition or because of your history, you're predisposed to develop mental illness symptoms. What do those look like? So I've listed a few of them that are very, very common. The first is the adjustment reaction. This is really the commonest of them, which is it looks like depression, it looks like anxiety, and it looks like a disturbance of conduct. These are sort of the official names, but that means that there has been some overwhelming stressor, in this case dealing with COVID-19, and then you develop, for example, if we're talking about depression, you develop symptoms of sadness, loss of interest, some hopelessness, you're crying, you can't sleep, but it just doesn't go on for very long. And then if it's anxiety, it's the same way. You have symptoms of worry, of tension, maybe you have a panic attack, you can't sleep, but it just doesn't go for beyond a week or a little over that. And conduct is when you're agitated or behaving in ways that where you're out of character, as they say. So this is adjustment reaction. It's a little short of the common depression, anxiety, because it goes on for a short time, and because it doesn't affect the functioning to an extreme way like the other disorders. Acute stress disorder, if any of you remembers any scary or traumatizing event and how you've been either crying or very anxious, or you can't sleep, or you have a nightmare about this same event that happened that really upset you. You startle very easy. It's called acute because it goes on for a very short time. And when I say short, anything between a day to a week, less than a month is sort of the nomenclature for this. The third is post-traumatic stress disorder. And this is very common. You hear of things like what happens with soldiers, what is called combat fatigue. This is like acute stress disorder, but it's really much more involved and much more serious. The symptoms are numerous, has to do with being hyper-aroused, has to do with feeling numb, have to do with re-experiencing again and again. You see it in daily life, the same bad experience that happened to you. You see it in your dreams, in your nightmares. And if it goes on about a month or a little over, it's called acute. And if it just becomes your life, like what happens to people returning from work, it's chronic. The fourth is onset of major psychiatric disorder. So like anxiety disorder, depression is very common. 1 out of 6 or 7 people in their lifetime will have that. Bipolar disorder and psychotic disorders. Now, the criteria for those illnesses are specialized. You don't really need to know them, but the issue here is can extreme stress cause them to appear? And the answer is yes, if you're predisposed and if you have enough of a stressor. After that is some people already are being treated for depression or for anxiety or for some other psychiatric disorder. They have schizophrenia. And all this news and all this stress can actually cause the symptoms to be worse or to really be triggered. And then for folks with just any other medical conditions, whether it's diabetes or asthma or heart disease, can stress make those worse? And dealing with COVID-19, hearing the news and all that, yes, it can, and we see that all the time in the hospital setting. Our colleagues in primary care and internal medicine see a lot of these patients whose symptoms are worse because of the stress. And the last one is substance use disorder. Here, people really cope sometimes with stress by drinking or using drugs. And that can really get out of hand where it becomes an addiction and it affects your functioning and your life. Okay. So we spoke about different presentations. How do you assess mental distress? I usually ask 3 questions. What are the predominant feelings or behaviors reported? And how long have they been experienced for? That helps me understand what this is and what disorder to diagnose. The second question is, how do they differ from the usual psychological baseline? So if you're presenting as extremely sad, are you cheerful at baseline? That helps me sort of gauge how much it affected you. And the third is really usual functioning, work, relationships, leisure. How are those symptoms affecting you? When to seek professional help? If you're suffering extremely, there's no need for that. You should seek a professional help. Not sleeping, especially nights on end, is not normal. You can't be not sleeping for 2, 3, 4, 5 nights on end. That is something you should seek help with. Loss of appetite and weight loss is also very concerning, and you should really look for a professional, especially if you're not dieting and there is no other health issue to explain it. And sudden and extreme psychomotor impairment. So if you're too agitated, all of a sudden you're fighting and you're bumping on things and you're crashing things, and that's not you. That's not something to take lightly, or the opposite of it. You're in bed and no one can pull you out of bed for days on end. You should seek professional help. And then thinking of death, dying, or having thoughts of wanting to harm yourself. And the last one is perceptual trouble, where if you're hearing or seeing things that others may not. Okay, next.
I think that was the last slide of your presentation. Dr. Louai, thank you very much for those valuable information. You have any other sentences to add before we go to the next speaker?
I'll just take questions at the end, but I think we're ready to go on to Dr. Hanan.
All right. Well, thank you very much. I appreciate that. That gives us a very good light. So we heard about the stress this pandemic is putting at the beginning with Dr. Yassir, and Dr. Louai now told us how this actually can transform into an actual psychiatric disease, and when should we actually seek help at that limit. From this end here, I'm going to move to our next speaker, Dr. Hanan Khairalla. Thank you very much for joining us, Dr. Hanan, and welcome to this live. If you want to just take a few seconds to introduce yourself for us.
Thank you, Akram. My name is Hanan Khairalla. I am a psychiatrist working at my private practice here in Massachusetts. I'm very happy to be amongst you all, and I hope that this presentation would be helpful for our people back home in Sudan.
Okay, so thank you again for joining us, Dr. Hanan. So a lot of what we heard so far can apply to everybody, but here within those circumstances, I'm sure there's a lot of stresses and a lot of mental strains implied over the healthcare provider, especially those who are providing care for the COVID-19 patients. So if you can just give us a little talk about what is the mental health condition and status of the healthcare professionals during this pandemic?
Absolutely. And actually, before I even talk about the current mental health situation, I do want to shed light as to how things were even before COVID-19 came along. Because the truth of the matter is, burnout was very prevalent before COVID-19. I mean, burnout is twice as prevalent among physicians as US workers in any other field. And the way that burnout expresses itself is in three categories, really. The first one is emotional exhaustion, just feeling like there's nothing more that you can give and feeling so fatigued and tired. The second form of expression is just feeling detached and disconnected from your patients. And the last form is a reduction in the sense of personal achievement and professional inadequacy. And so you would start to notice that your performance isn't the way that it used to be before, and that there's some poor self-confidence or self-esteem. So burnout wasn't the only prevalent problem before COVID-19. There are other mental health disorders that were pretty high amongst our healthcare task force, and some of those were anxiety and depression. They were pretty elevated. And let's not forget that doctors have the highest suicide rate of any profession. But why is that? I mean, we came into this career and we succeeded in this profession with pretty high resilience. So why is there such a big problem amongst healthcare workers? And the biggest reason that was found was really organizational. The workplace isn't set up in a way that promotes well-being and allows employees to flourish. But that's not to say that doctors and nurses also have some unique features that's not exactly similar in other populations. And those features, those unique features, is that it's so hard for us to reach out for professional help. And there's this underlying feeling of shame and professional failure for feeling the way that we feel. It's not just hard for us to reach out for professional help, but it's also hard for us to reach out for help from our colleagues or friends or families. And so then came COVID-19, and it brought with it a lot of chaos, uncertainty, just a lot of work. And on top of that, a lack of protective equipment. There are poor resources, there aren't any ventilators, no beds, and there's not even a specific treatment that we can use to help, as well as other organizational problems like conflicting guidelines, inadequate support. And so the result of all of this chaos was really a surge of emotions. A lot of us would feel helpless about the situation, fearful that by going to work, we'd go back home and infect our loved ones. And then there's the moral injury, where in countries like Italy and so forth, there's that choice that the doctor has to make as to whether they should supply life support to one patient over another. And then there's guilt, because for me, for example, I've been able to work from home since I'm working as an outpatient doctor. I feel guilty for not being in the front lines. An emergency doctor who's the first person to receive COVID-19 patients, and other feelings of grief and anger. So what's the impact so far? And to answer your question, Dr. Akram, what's the current mental health situation with the healthcare force? So there was a study that was done in China, and the results were actually astounding. 50% of the frontline healthcare workers suffer from depression. 40-something% have anxiety. 30-something have insomnia, and 70-something have percent of people have just feeling distressed. And when we look at suicide, Italy had problems protecting its staff and had really poor supply of protective equipment. And so they reported multiple deaths by suicide among nurses. And there were other deaths that were reported in Iran and Indonesia. And over here, we unfortunately lost an ER doctor to suicide in New York City. She actually had symptoms of COVID-19, was diagnosed with COVID-19, and treated patients with COVID-19. And then unfortunately, she committed suicide. And so what are some of the interventions that are helpful? And the way that we can look at it is from previous studies that were done in burnout. And the most powerful intervention that was found to be helpful was actually organizational directed interventions. But that's not to say that individual focused interventions also work. So what can organizations do? And really, there's a lot of simple things that organizations do, such as just providing, food, water, and rest for their employees, resolving the situation with housing and transport, so that the employees don't feel so anxious about returning home and infecting their loved ones. Other things like keeping track of the hours that the employees are working, and having that two-way dialogue. And I think that that's one of the most important things that can really be done, is that listen to the employees, and appreciate really the work that they are putting into this. As far as what team members can do, as a team leader, just be a good leader. I mean, it's easier said than done, but especially that the team leader is also in a current state of crisis. But it really goes a long way. Staying human and humble and communicating with your team, empowering them and appreciating them. And as far as colleagues, if you spot signs of concerns in your other colleagues, like they start skipping work, they look tired, they look down, and just offering to giving them the opportunity to talk. Like, don't be forceful, but just be there, to laugh with them or to cry with them, and be consistent about it, and be reassuring. And most importantly, encourage them to have good self-care. And then, you could help them explore the causes of their distress. And if you can help them address it, that's fantastic. But if it's larger than that, then consider escalating the concerns. So what can you do for yourself? And really, we go again to the basics. And so don't isolate yourself. Stay in touch with family and friends by phone, Skype. Don't forget about exercise. The weather is actually becoming beautiful nowadays. So taking playing with the bicycle for a bit would be nice. Don't eat wrong. Sleep well. And stop tuning into the news so much with excessive information consumption. take the time to rationalize the risks of infection to yourself and your family so you can feel comfortable going to work. And recognize and acknowledge what you're feeling. Solve the problem. If you have a problem with your income, housing, loss of job, just look at what's available for you right now. Reflect on what gives life meaning. Sometimes we forget that the job that we're doing right now it's a pretty powerful job. We're healing others, and it really gives a purpose in life. And so, keeping that in mind while working would really be helpful. And allow yourself to be proud of your important role in society. And most importantly, know who forms your peer support network. Peers have the shared experience that they go through together. And so their communication is usually better. And so check and see if there are peer support networks there for you that are available for you, and where to access external support should you require it.
Well, thank you very much, Dr. Hanan. That was great. Great points related to the healthcare providers, all of us who are actually having a huge impact from this pandemic, added to the significantly increased rate of mental health issues among the healthcare providers compared to the general population. I appreciate your input on that. I'm going to be moving then to my last speaker today, Dr. Timothy Zeiger. Dr. Timothy Zeiger is a licensed psychologist, and he was kind enough to join us today and helps up on this presentation. Dr. Timothy, if you would like just to start by introducing yourself, then we'll move on to your presentation.
Okay, great. Yes, my name's Dr. Timothy Zeiger. I'm a licensed psychologist here in Hershey, Pennsylvania, and my area of expertise is working with children, teens, and families.
Okay, so Dr. Zeiger, we heard a lot of things about stresses when they become mental health issues. We heard also from Dr. Hanan about the effect of that on the healthcare providers. I want to just move on to the next slide. So we hear all of that. What kind of coping mechanism options do we have, whether the individuals, sick or no, the family members among our families at home, and even some that we can apply as healthcare providers to improve our mental health?
All right, absolutely. So I'm going to talk about COVID-19 and the impact it has had in its short period of existence to our knowledge on families. First and foremost, this COVID-19 crisis has had a major impact on families, in particular the family dynamic. I know in my own clinical practice here in Hershey, I have seen increased spikes in anxiety in children as well as adults. I have seen more tension in parenting relationships between adults caretaking for children, as well as an increased tension and communication between all family members, as well as how they are relating with one another. So a big question I often get asked is, what can adults do? The first thing that I recognize is that they become self-aware, as some of my colleagues in this presentation we're talking about. The first thing that I often suggest is that the individual become self-aware of what they're experiencing. So that could be mentally, emotionally, or physically. The second is that they're honest with themselves about how they're feeling and what they're experiencing, and the same with their children. Also, as my colleagues did an excellent job of highlighting, it's very important to identify supports, whether it be within the immediate family system or within the community. These can be things such as religious organizations or other community-based organizations. And then lastly, identify potential pro-social coping strategies. So I often recognize and suggest things like exercise or prayer or worship or just texting an old friend or giving them a call on the phone just to kind of talk about anything. Then when it comes to what we can do to help children, I strongly suggest a developmental approach. Some key things to factor in are the chronological age of the child, but more importantly, developmentally, the stage that the child may be in. So things we want to look for are how much does the child comprehend, or are there potential learning issues or cognitive delays, depending upon the child's developmental and age. Is kind of how we should answer and ask the questions of these children. So another big question I often get asked is it okay not to know? And I say absolutely. It's okay for adults not to have all of the answers. The media has labeled this as the virus. The coronavirus itself is novel. We know very little, if any, about it. Details are emerging each and every day. So I think it's okay to let children know that, as I'll talk about here in my next slide. So next, I always stress the importance of listening rather than trying to solve. So adults can really help other adults as well as themselves, and more importantly, children, by just listening, and more importantly, reflectively listening. So just briefly summarizing back to the child or the individual that they're speaking with what they've heard in maybe 5 to 10 seconds or less. Also, I think it's important for adults to ask open-ended questions versus yes or no questions. You'd be amazed at what children are really thinking, but won't say if you ask them yes or no questions versus if you ask them a more general question. And then lastly, it's really important to give open and honest answers. And again, as on the previous slide, it's okay to let kids know that we're not 100% certain, but we're going to do everything in our power to try to keep them healthy and safe. So I also think it's important to state the facts, but more importantly, I find that actions are very important. So as some of the other presenters were mentioning, I think it's important to be honest about things such as the seriousness of the virus, so how it spreads or ways that we can prevent it, such as social distancing and the importance of doing so each and every day until we get a bit of control on the virus and the transmission process. But more importantly, it's also very important to lead by action. Whether we believe it or not, children are always listening and watching us each and every step of the way. So it's very important that we practice social distancing, that we practice proper hand hygiene and hygiene practices in general, because kids are going to follow our lead as a result of that. Also, I think it's very important that we remain calm. Even if we're not feeling calm in the inside, that's something that we really need our children and young people to see on the outside. So I think that starts at the home, in the home, but I think that is also a very important thing for people on the media or our health officials or our elected officials to do the same. And then lastly, I think it's very important that we don't overshare about what I label the adult matters. So I think my colleagues did a very nice job of summarizing some of the stressors pre-COVID-19 and that we're currently experiencing during this pandemic of COVID-19. But I think it's a good reminder not to overshare things such as job loss or financial things, or whether we have enough food or enough money to the next level. And then just piggybacking on some of what my other colleagues said during this presentation, when to seek professional help. I think it's really important when adults are beginning to understand that they're feeling overwhelmed. So whether that be emotionally or physically or mentally. For children, these symptoms can present differently than in adults. Children can show signs of chronic distress, again, very differently. So they might be having increased nightmares, bedwetting, refusal to sleep in their own bed, demanding to sleep with mom or dad or their caretaker. They're just having general difficulty controlling their fears. So again, depending upon the developmental age of the child or the chronological age of the child, that's going to look very different. But for our younger kids, that might be repeating questions over and over again, or seeking general kind of reassurance. And we may even see that in our older population, such as teenagers as well, reverting back to a younger developmental stage. Younger children also may have some separation issues from mom or dad or caretakers or even siblings. And then a symptom that may be misunderstood but can be chronic sign of distress or anxiety is inability to focus. So oftentimes that could get mistaken as the kid having attention problems or possible ADHD. So with a good clinical kind of interview or asking kind of pointed questions, we can help kind of differentiate, is it truly attentional or is it more anxiety based? All right, so my colleagues and I have developed this list of available resources that we would like to share with you. First and foremost, if your feelings or behaviors are again causing extreme suffering, or if your symptoms are inhibiting your functioning, it's very important to seek help from a professional. So whether that be a psychiatrist or a psychologist or a therapist or any other licensed mental health professional. Secondly, if there's some type of suicidal feelings or thoughts, or if you're fearing for your life or the life of another, the first step should really be to contact 911. There are websites out there such as the National Alliance of Mental Illness, the National Institute on Mental Illness. Web links are right there in the slides, as well as many others that can be very beneficial with a boatload of resources. And lastly, find numbers for mental health through your medical insurance company, local, county, state websites as well. So in summary, COVID-19 is a very stressful time. We've never seen anything like it for most of us in our lifetime. And reactions to the stress of the pandemic really run a continuum. And we can actually see that some people can successfully cope with it on one end of the spectrum to the very other end of the spectrum where there can be some burnout. You know, we also spoke about positive coping, and that ideally that's the best way to try to get through this pandemic. Mental illness symptoms, they can be triggered or worsened by one's reaction to stress. And again, it's individually based. No two individuals are alike. For the healthcare professionals and providers who joined us here today, you know, it's important to know that we're also susceptible to this continuum. Families can be successful in coping with the pandemic. Again, being open and honest and understanding the developmental stage and remaining calm. And then finally, you know, it's each of our responsibility to seek professional help when there's suffering or potential danger to oneself or to others, or when someone becomes self-aware of global impairment. So I'll turn it back over to Dr. Akram.
Thank you very much, Dr. Zeiger. That was very helpful coping mechanism for all of us, healthcare providers and the public, to try to understand what's going on, try to cope with this, and help our families, our children also to cope with this. Well, that was very great and awesome hour of talk, very valuable information. Thank you very much, everybody. I'm going to be moving to a some time for questions and answer from our viewers. I remind everybody, please, if you have any questions, just post them on the Facebook or YouTube channel for this live streaming, and we're going to be posting them for our speakers here to answer them as we go through. So I'll start with the first question from Bahi Malik. Bahi is asking, with patient being in the ICU, especially those who are intubated, they are usually experiencing PTSD, which is a post-traumatic stress disorder, depression and anxiety due to their ICU stay. What is the role of the psychiatrist in the ICU to reduce those complications? I can pass this question to Dr. Yassir Mahgoub.
All right, thank you very much. Thanks, Bahi. Has been a while since I heard from you. With regards to this question, it's very important. It happens almost on a regular basis. Doctors have to put in their mind that the patient, when they're anxious, they're losing control. They don't know exactly what is going to happen to them. Some of them, they panic. Some of them, they cry. Those are normal feelings. Those are not depression. Those are not just a constant state of sadness. Those are normal reaction to the situation that they don't know exactly what they're going to be handling. So doctors should familiarize themselves with being okay with that feeling. When the physicians sometimes try to mirror the sense of control and the sense of calmness, This can help the patient to calm down, providing some reassurance, hope, not lying to the patient, being realistic can help too. I've heard actually about some initiatives from some of my colleagues in New York. I used to work in New York last year for 3 years, and I'm very like, I mean, it was a very good place there. They have been collecting iPads from the community to provide them to the hospital, to give them to patients to be connected with their family members. It helps to give a lot of reassurance to patients, to help them to calm down, to help them to stay connected, to help them to be with their families, with their loved ones, and to get some support. This is a positive, actually, initiative. If we can actually make this nationwide to collect iPads for family, for hospitals, this can be a huge support. The second thing, sometimes if this is not helpful, this is not in control, I don't see a problem with giving some medications. Benzos can be of help during that time if reassurance by itself is not helpful. This can be used.
Thank you very much, Yassir. I'll go ahead to our second question from Psy.D. Safi is actually asking about something you just touched on, Yassir. He's asking if there is any role of small dose of benzodiazepines in the or benzodiazepines in decreased anxiety in a patient, especially those in isolation rooms. He's saying we are really facing such problems or such kind of problems in those patients because they show signs of anxiety mostly at day 2 of admission. His colleagues suggest to keep those patients small dose of benzodiazepines as early as they are admitted to help with those. So I will pass this question to Dr. Louai Bilal. What do you think? What's your insight about that?
Thank you, Safi, for the question. It's a great question. I think small dose benzodiazepines can be helpful in this situation. The big anxiety for the prescriber is whether I'm going to be causing addiction in this person should really not be relevant here at all, because this is one of the few times when it's clearly indicated that you should give a benzodiazepines. The other point related to that is that a lot of the times we may not have access to a psychiatrist who may feel more comfortable prescribing that. It would be the ICU physician, or it would be the hospitalist or the emergency room doc. And you actually do this patient a tremendous service by offering it. One thing to allay any fears about prescribing these medications, you can know what would be the absolute contraindication. So there are really very, very few. They have to do with someone actually having substance abuse issues, someone who's an alcoholic, someone who's med-seeking, and someone who, while you're assessing them, they don't appear to be anxious. So you believe your own eyes. They don't look like they're anxious to you. So that's a red flag. And the second is really age. So elderly folks, 65 and above, that would be an issue or a cause for hesitation, because it can actually make them worse, can actually cause them to fall, and can affect their memory adversely. But for the majority, you have a huge range from 18 to 65 who can tolerate benzodiazepines, so you should be given it. The second thing is, if you don't have access to a psychiatric colleague where you can just call them up, or you just simply can't, or you want to do something proactive, remember two things about the pharmacology about benzodiazepine. Low dose and low duration is by definition almost no problem. So and what is low dose? Low dose is anything less than 2 milligrams is okay. So people start with 0.5 milligram or 1 milligram. I found by experience that for someone who's actually very anxious, the sweet spot is 1 milligram, not half. You don't want to underdose. It's not necessary. It's not needed. 1 milligram almost always works for the majority of people, especially those in the age ranges between 18 and 65. If you're discharging them, where I work in Kaiser Permanente, and I'm sure in many, many places, you're strongly encouraged not to discharge anyone with more than 5-day supply of the medication. So there's really no risk if someone doesn't have substance abuse issue or is elderly. So stick to that dose. And lastly, I'm going to say, in my experience with folks who have no addiction and who are actually experiencing tremendous anxiety, they usually need 1 dose or 2 doses. That's it. So it's a great question, and I would say go ahead and prescribe those benzodiazepines. Stick to a dose no more than 1 milligram and no more than 2 or 3 times a day. But that would go a long way. It can actually help you with the general medical condition that you're trying to help.
I will follow up on actually the question again, and again, like, it's a good option. However, I just want to make sure you're not dealing with delirium. Somebody who's dealing with fluctuation of the level of consciousness, and part of their presentation is some anxiety. And we're talking about somebody who's aware, awake, well-oriented. However, they're just dealing with an anxiety. If we're talking about somebody who's confused, however, they're manifesting with some anxiety features, you should be avoiding benzos in those population alone.
That's a great point, and I agree with that wholeheartedly. So like any other medical specialties, it's what is your diagnosis? What are you treating? And if it's an anxiety, it's just clear-cut anxiety, then you're good. But if you're dealing with delirium or with other conditions that are just complicated and not clear-cut to you, you should pause before you prescribe.
Thank you very much, Dr. Louai. Dr. Yassir, that was a good plea. When I do something, also use all the available resources to you. Although a lot of the providers now are working from home or using telemedicine visits and the video capabilities, you still have the psychiatrist and the psychologist available, and feel free for individual cases to reach out to them for consultation. I'm going to be moving to another question here from Ala Fadlallah. Ala is asking a very similar question to the first one, but it looks like it's more toward the or related to the healthcare providers. He's saying during the care of COVID patient, they are lonely. Families are not allowed to visit. Doctors and nurses limit exposure, and they are dressed up and covered up. Some even commit suicide. What can be offered? I think Dr. Yassir asked or answered a lot of those in the first question, but maybe I can hear from Dr. Hanan here. Is there anything else we can add? And also, I'll give Dr. Zeiger an opportunity to add to that afterward.
I don't really have much to add. What Dr. Yassir had talked about is the availability of laptops or iPads or iPhones to really just be able to remotely communicate with their friends and families. We get asked that question a lot, and it's really unfortunate with the current situation that's going on in hospitals. But there's nothing more that can be done. The other thing that Dr. Yassir also talked about is just reassuring and having that calming presence from the healthcare providers that are taking care of those patients.
Thank you very much, Hanan. Another question also that came to us from Salma Al-Faqih. She's asking, how would you advise the PCPs, the primary care providers, and the pediatricians to address the situational anxiety and depression we are experiencing? And I'm not sure, it seems like by the saying we are, she's referring to the healthcare providers. I'll pass that question to Dr. Zeiger.
Sure, thank you. So I think I can loop back to one of the slides that I was talking about, and that relates to self-awareness. So I think it's important for all of us as healthcare providers, especially those on the front line, such as a PCP or a pediatrician, who still may be seeing patients physically in the office or even through telehealth means, to be aware of what they are experiencing. So what are they experiencing physically and mentally? And to seek some of the supports that we've been talking about. So That can be connecting with immediate family members or friends or other colleagues if they're working in a clinic practice or an institution. So I would suggest things such as that.
Thank you very much, Timothy. I'm gonna move on and to the next question from Dua Omar Jadasid. Dua is directing her question specifically to Dr. Louai Bilal. She is asking that, or specifically saying, you mentioned the most common clinical presentation during the COVID-19 pandemic. She is curious about the health anxiety, such as illness anxiety, which is pathologic anxiety, I'm guessing, especially those who are already dealing with the condition. Any insights on that?
Yes, thank you very much for the question, Dua. I hope I understood this question correctly. So if I didn't, I'm going to talk about two things. So maybe one of them is correct. It has to do with what Dua means by illness anxiety. So there are two things that come to my mind. There is a condition called illness anxiety disorder, which is sort of the colloquial for that is doctor shoppers, people who go to the doctor so many times because they feared something is wrong with their body, but actually there is nothing. There is all these tests and investigations that they subject themselves to, but there's really psychological drivers that are deep-seated that cause it. So what happens to those during the COVID-19 epidemic really depends on the case. I have a couple of folks that I'm treating with that condition. One of them actually, the COVID-19 pandemic just caused them to stay at home and not to bother their providers with requests for tests or what have you. The other one also stayed at home, but had a bump in their use of phone consultation. So they ended up calling very aggressively, which tells you that they're anxious. So that's my thought about this specific condition, illness anxiety disorder. Now, if Dua had meant anxiety associated with a general medical condition, that's also very common and very important, which is folks who are, for example, admitted for brittle diabetes or congestive heart failure, or they're dealing with a cancer diagnosis. And then on top of that, you have the concern about the COVID-19 pandemic, and that just adds to the stress. What I've seen, a little bit about my role in the hospital, I also do consultations in the hospital. So I do get consultations that are similar along those lines. And I do find that people's sense of anxiety has increased, not only because of their health condition, but because of dealing with the fear of the virus itself. And more importantly, like my colleagues were just talking about in the previous question, not being with loved ones and not being able to have visitors and that kind of thing. So my role has increased in the sense that I make myself more available to them. Sometimes I treat with medications, but I find that it's just having me present there to listen and to provide a window into some discussion about some stuff they love or gives them good memories is very necessary and is very helpful. And so this really harkens back to the role of the psychologist or the psychiatrist in helping folks coping with general health conditions, where these are people, you may treat them physically, but you really have to address their anxieties. I hope that answers your question, Dua.
Thank you very much, Dr. Louai. I'm going to be moving to another question from Yassir Ibrahim. Dr. Hanan, you touched on that a little bit, so I'll give you the chance to answer that. Yassir is asking, what are the activities that can be done at home to reduce or manage stress? And when should one seek professional help, and how to tell that help is needed? Hanan, you just need to unmute yourself.
Sure.
Yeah, thank you.
I get this a lot from my patients who have been quite stressful, really, with this quarantine and just being cooped up at home all the time. And the advice that I give them is to first have some structure to your day, and take some breaks and actually go for walks. If you have a dog, walk the dog. I use that opportunity to, ask them to walk briskly, really, to have some form of exercise. But other things that can be done at home, also in regards to exercising, is yoga. And as healthcare professionals, we actually have a free application that's offered by Headspace for all healthcare providers. All you need is just your NPI number, and you'll be able to access that application. It has a lot of meditation. There's meditation in there, and just really stress relieving videos in there. And when should you seek professional help, and how to tell that help is needed? I would say that when you find that the symptoms are overwhelming to the extent that they are causing dysfunction, and so if you're not sleeping at all and just feeling really tired, and you start skipping work, and can't focus, I would say that that's when you should really seek professional help. And it can be as simple as reaching out to a therapist. Nowadays, we're communicating with our patients via telehealth. It doesn't even involve you needing to leave the house. So that's my suggestion as far as seeking professional help.
Thank you very much, Hanan. Dr. Zeiger, any more insight or input on what Dr. Khairalla mentioned?
I think she really brought up some great points. I know for my pediatric patients that I see, schools are out pretty much across the country. So I always stress the importance of having like a regular sleep and wake time, and then scheduling routine activities throughout the day. So.
Thank you very much. Going to
I'm
another
sorry, Dr.
question.
Akram. I just want to add on to what Shaima just wrote. Meditation, including prayers, and I think we're forgetting to include that, as it is a big part of our community. Just religious and spiritual aspects are really found to be helpful with reducing and managing stress.
Thank you very much, Dr. Hanan. I'll be moving to our last question here from Salma Al-Faki, and I'll pass that question to Dr. Louai. She's asking about the use of hydroxyzine in pediatric and adolescent patients, specifically for anxiety and sleep difficulty. What are your thoughts on that?
Thank you, Salma. Good to see you here on this forum. You can use it, no issues, but I think it's one of the safe general medications to use. As far as I know it, I haven't prescribed in children and adolescents myself for a very long time, but I think I understand the pharmacology of it. Like trazodone is also used, even though it's an antidepressant, it's used sometimes as a medication for sleep with less fears about the addictive liabilities and all that. But what I would say the guiding principle would be is you should try a few things. If hydroxyzine helps, that's great. So just use that. And then be mindful of the duration. Short-lived is almost always not a problem. If you're giving someone, especially for insomnia, a short leash of hydroxyzine, or even benzodiazepine if you need to, which is used very much more rarely in children, then if it solves the problem in few days to a week, no problem. If it goes beyond that, then you should just get a consultation. That would be better. So to have them, if the sleep problem continues and the anxiety continues, then it's really better to send them to a child psychiatrist. But hydroxyzine is absolutely a fine choice.
Thank you very much, Dr. Louai. I'll be just passing one last question that came just in the last moment. That will be the last one before we kind of stop here. It's from Muhammad Salah Al-Fahal. He's asking if there are any criteria for the psychiatrists that they use to prioritize the form of interviewing, direct interviewing versus remote, with patients with COVID-19 who have mental illnesses. How would you exactly approach such patient? What makes you decide whether you want to go actually and see the patient physically versus you just go and do it through a video one? If anyone is happy to pick that question.
I can go first. Yeah. So the main decision. Nowadays, most of the time for a patient who's COVID-19 positive, we do a video visit. So it's set up by the staff in the hospital unit, and then we can see the patient that way. You should go see the patient if, while you're doing the video visit, you still are not sure about diagnosis, or you're seeing, for example, a movement problem that you don't understand, and it would be better for you to see close up. But in the overwhelming majority of cases, video visits for someone who is in isolation or COVID-19 is great. What I do regularly is I ask the patient, actually, if they felt that they needed to see me personally. And most of them understand completely what's going on, and they say no. But that's I tend to give that option because I don't want to not give them that option. And if I had any reason to not be there, I would let the patient know. But most of the time, the phone or the video visit does the trick.
Just to add one thing again to the question. So the way we have been performing mental health, like providing care, has changed. So, but inpatient continues to remain one-to-one in most of the hospital. There's a doctor, there is actually a professional who's going to see the patient one-to-one, face-to-face most of the time. Outpatient and consult psychiatry, they move to the telemedicine, like video conferencing in order to see the patient. If this is sufficient, again, fine, especially mainly for outpatient. If they're not feeling comfortable, they'll send them to the hospital. It gets tricky only with the consult. Most of the time, they do sometimes curbside consult, where they discuss with the team even without seeing the patient, or sometimes if it's a little bit not obvious, I mean, as Louai mentioned, they will have some times to go and see the patient physically, face-to-face. Some obscure kind of mental conditions, sometimes when it's a little bit challenging to know by only the video.
Thank you very much, Dr. Yassir. This actually concludes the section for the question and answer. By this also we conclude our live video with our panel today that was focusing on perspective on the mental health effect of the COVID-19 pandemic. I would like to thank all my speakers, Dr. Yassir Mahgoub, Dr. Louai Bilal, Dr. Hanan Khairalla, and Dr. Timothy Zeiger for the valuable information that was presented in this opportunity. I would like also to thank all our viewers, all the gentlemen and ladies here in the United States and Sudan and all parts of the world who attended. I would like also to remind everybody that this pandemic has a huge effect on us, psychologically, physically, health-wise, economic-wise. We should not underestimate the mental health effect that all of us, whether healthcare providers, individuals in the community, families, or the public in general, are facing because of the counter effect or the effect and the counter effect of this pandemic. Thank you again for attending us today. We will try to answer any questions that come after in the comments section, but I appreciate your attendance and thank you very much and enjoy the evening.